My name is Curtis Allmeter. I'm a cystic fibrosis patient here at the Barnes-Jewish Hospital, and I recently received a double lung transplant on December 24th, Christmas Eve. I've been working on a photo documentary of my journey through the before and after transplant, and some of my personal experiences with the ordeal. And the photograph of me, I'm actually doing a breathing treatment. It's probably albuterol and palmazine. Those are both nebulized. They're pretty common drugs for cystic fibrosis patients. The albuterol is a bronchodilator. It allows you to, opens up your airways, allows you to breathe a little easier. And then the palmazine will helps liquefy some of the secretions to cough out. They also do chest physiotherapy. There's a few different methods. The one that's actually happening in the photograph is called CPT, and it's basically the respiratory therapist kind of claps on my back and sides, and it allows me to cough up some of the mucus in my lungs. The next picture is a photograph of me getting a blood drawn. A lot of the IV antibiotics I receive they're pretty strong. I usually get quite pretty high dosage of them, and they sometimes have some bad side effects, and they try and monitor the levels of the antibiotics in your blood, which requires them to draw blood pretty much every day, sometimes a couple times a day. And your veins get pretty sick of being stuck all the time. Yeah, the next photograph is a picture of some of my medicines. I've been on medicine, taking enzymes, digestive enzymes, since I was basically born. And in addition to those, I've been on vitamins and different supplements, and just all kinds, just a whole slew of medicines. I joke around because I say that after I take my morning meds, I'm full. I don't have room for anything else. The next picture is a photograph. I'm on a treadmill and as a patient here at Barnes Hospital, where I receive my treatment now. I had switched my care from the Columbia, Missouri University Hospital to Barnes-Jewish Hospital in St. Louis, and as a patient here, they're advocates of exercise, and they try to get you on a treadmill or get you moving a little bit every day. They shoot for 30 minutes a day, and one of the requirements for patients seeking a lung transplant is that you're able to maintain some sort of exercise for 30 minutes. The next photograph, there was a patient again at the Barnes Hospital. I was sitting in my room, and they on the 13th floor. That's kind of the floor dedicated to transplant and cystic fibrosis patients. It's been a really pretty great stay there. If I had to be in the hospital, I would definitely like to be on that floor. It's the nursing staff is really great, and they've got wireless internet and TV and stuff. It's really not too bad. The next photograph, this was one of the periods of time I think I had a pneumothorax, partly collapsed lung, and I was feeling really junky. Then as the disease progresses, a lot of times, as I said earlier, your strength and endurance seems to kind of fall off, and you really, people ask you if you're sick or you're healthy, and you're never really healthy. You're just kind of there, and they try to monitor your pain level and stuff. Until I got lungs, I didn't really know what it was like to feel good again, to feel healthy. I was just kind of trying my best to get by before, just trying to breathe, I guess. The next photograph is a photograph back at the Barnes Lodge. It's where I stayed for about a month before we found another apartment. The Barnes Lodge is owned by the hospital, the Barnes Jewish Hospital, and it's mainly for patients and families of patients that are having to stay for a period of time for medical reasons. Before my mom and I relocated to St. Louis, we kind of threw together some fundraisers and had a lot of friends and family that were helping with that. And so anyway, in our spare time, we would write thank you notes and stuff to the friends and family that were so helpful.